to our dear guests, teachers, fellow classmates, and friends. A pleasant morning to all of you. We are convened here today for a distinct and significant event, to talk on the different diseases of the circulatory and respiratory system, and to invoke the Spirit of God to us today. May I call on Jared Byron Casilda of grade 9A for the opening prayer. Please all stand.
Let us remember that we are in the most holy and loving presence of God. In the name of the Father, Son, Holy Spirit. Dear Lord, we stand before you in humble prayer before we start this program. We thank you for everyone gathered here today. We also thank you for the speaker and facilitator. May you give them inspiration as they share their knowledge. We ask that you would open our minds so that we may hear your voice, awaken our minds so that we may obtain your wisdom, and open our hearts so that we may receive your eternal knowledge. This we ask in Jesus' name. Amen. St. John Baptist del Salle, first. With Jesus in our hearts forever. In the name of Father, Son, Holy Spirit. Amen.
Thank you, Gerard. Respiratory and circulatory diseases are common problems in our world today. And many times, people are genetically more likely to get circulatory or respiratory conditions. But workplace or environmental exposures can also play a big role. You may now be seated. May I call on Ms. Michelle Ballesteros, grade 9 science teacher, to formally welcome our speaker for today's event.
Before we introduce our speaker, may I request the grade 9 students to please sit properly. Be ready with your notes and worksheet. Good morning, grade 9 students and Thessalian partners. We are very lucky to have a special guest. And of course, please do note that we're going to learn a lot from this person. She graduated from Philippine Science High School Diliman Campus in 1986. University of the Philippines College of Medicine in TARM program in 1993. She got also internal medicine residency training at Riverside Medical Center. Pulmonary subspecialty training at PGH Medical Center. Fellow of the Philippine College of Chest Physicians. Active consultant of Department of Internal Medicine, Riverside Medical Center. And he's a physiology professor at University of St. LaSalle College of Medicine. Without much ado, let's give a big round of applause to Dr. Ethel Marie Locson.
Thank you, Ms. Michelle. Good morning, grade 9 students. I know many of you, I've been your tita since you were in prep, and I've been with you during activities, and I've been your driver, so you know me very well, okay? But I'm also a pulmonologist, so finally, in your grade 9, your teachers have been kind enough to ask me to speak to you, and I hope to make the most of the next 30 minutes. And what you learn here, I want you to practice every day to protect your own health and to protect the health of your family and the community. So in the next 30 minutes, I have been tasked to give you an overview of common pulmonary and cardiovascular diseases. So the objectives for this morning's session are as follows. I'll be describing some important diseases affecting the pulmonary and cardiovascular system. to show how lung disease can lead to cardiac dysfunction, and similarly, how cardiac disease can lead to lung dysfunction. And I'm going to have a review of the management and prevention of these important illnesses. So I want you to give me your best guess, okay? Pakot-pakot. You can already make an educated guess. I just want to show hands. And it's okay to make a wrong answer because kung magsala ka, tira pa ka ng kadumdum nga sala ka liyaton answer, you will remember the correct answer mo. Okay, I'm going to give you case number 1. This is a 60-year-old male engineer with recurrent cough and phlegm for the last 2 years. Difficulty breathing when climbing stairs. He's been smoking a pack of cigarettes per day for the last 40 years. And the doctor could hear wheezing on auscultation of the lungs. So, case number 1. What is the most likely diagnosis? Who says it is pulmonary TB? Raise your hand. Okay, 2 people. 3. Who says this is pneumonia? 1 person. Who says this is bronchial asthma? Okay, probably 10% of people here. Who says this is chronic obstructive lung disease? The majority of people here. So you have been taught well in your science class. And I agree with you. Okay. Okay, please watch this video.
Understanding chronic obstructive pulmonary disease, COPD. Chronic obstructive pulmonary disease, or COPD, is a lung disease that makes it difficult to breathe. COPD is a long-term disease that often gets worse over time and is characterized by inflammation and severe limitation of airflow in and out of the lungs. COPD is an umbrella term used to describe a group of breathing conditions, the most common being chronic bronchitis and emphysema. Many people living with COPD may have both emphysema and chronic bronchitis. A few people have both asthma and COPD. Cigarette smoking is the leading cause of COPD. Long-term exposure to secondhand smoke or irritants such as air pollution, dust, or workplace fumes, and biomass exposure such as wood smoke can also contribute to COPD. An uncommon genetic disorder called alpha-1 antitrypsin deficiency is sometimes associated with COPD. Although respiratory infections such as influenza and pneumonia do not cause COPD, they can make people with COPD very sick. Therefore, it is very important to keep these vaccinations up to date. At first, COPD may cause no symptoms or only mild symptoms. As the disease progresses, common symptoms include shortness of breath, wheezing, and chest tightness, especially with exercise, and an ongoing cough, often with a lot of mucus. As COPD symptoms worsen, breathing requires much more energy, and it can get harder to exercise or do routine activities like getting dressed or climbing stairs. This may lead to fatigue, weight loss, and muscle loss. People with COPD can experience a variety of symptoms. Different stages of COPD range from mild to moderate to severe. In normal functioning lungs, when air is inhaled, it travels down the windpipe and into the airways, or bronchial tubes of the lungs. Inside the lungs, the airways branch out into smaller and smaller tubes called bronchioles that are rich in blood supply. At the end of these tubes are billions of tiny air sacs, called alveoli. Normally, the walls of the airways and air sacs are elastic and flexible in nature. Inhaling causes each air sac to fill with air. Exhaling causes each air sac to deflate. Efficient uptake of air into the lungs provides oxygen to the blood, which is then carried to all parts of the body. In COPD, however, the airways become thick and inflamed, and they produce more mucus than usual. This mucus can clog the airways and makes it hard to breathe. In COPD, the walls of the air sacs in the lungs are damaged and lose their elastic quality. The air sacs get floppy, broken, and lose their shape. As the air spaces get larger, air gets trapped, and there are fewer air sacs to supply oxygen to the blood. Because air is trapped in these air sacs, it is difficult for lungs with COPD to deflate like normal lungs. This trapped air makes it harder to get fresh air into the lungs and makes breathing more difficult. COPD is the third leading cause of death in the United States and affects more than 13.5 million Americans. It is predominantly diagnosed in middle-aged individuals older than 40 years and is present in both women and men. Although COPD is more common in men, more women die from this disease each year than men. The rate of COPD continues to increase worldwide due to smoking and worsening air pollution. While there is no cure for COPD, you can take steps to feel better, stay more active, and slow disease progression. COPD can be managed by consulting early with your healthcare provider, seeking diagnosis and intervention therapies, and adopting lifestyle changes that include quitting smoking, pulmonary rehabilitation, healthy eating and exercise, and maintaining a positive outlook.
So chronic means long term. Okay? Obstructive means there's a barrier in the flow of air. There's a decrease in flow of air. So that's what chronic obstructive pulmonary disease is. And of course, the most common culprit is smoking cigarettes. But in the Philippines, we have many elderly women with COPD who did not smoke. These are the rural women who cook on wooden stoves and they are exposed to the smoke. So that smoke exposure eventually causes them to have COPD when they are older. So the symptoms have been discussed well. We diagnose COPD by spirometry. We make the patient blow into a spirometer, and the computer will show figures and numbers which will help us clinch the diagnosis of COPD. And of course, you have to stop smoking. We give you bronchodilators. We vaccinate your COPD patients, enroll them in pulmonary rehab, and if it's so severe, we give them oxygen at home. So let's proceed to case number 2. Again, your best guess. 70-year-old diabetic, hypertensive male, hospitalized a year ago for a quote-unquote heart attack. He now has difficulty breathing when walking fast, and he needs to prop up his head with 3 pillows when lying down. Otherwise, he'd have difficulty breathing and lying down. And he has swollen legs. And when the doctor listens to his lungs, there's crackles in both lungs. Okay, what do you think is the most likely diagnosis? A, is this bronchial asthma? No. Is this chronic obstructive pulmonary disease? No. Is this pneumonia? 1 person. And is this congestive heart failure? Majority. And the rest did not answer. So it's very good. You have an idea. This is congestive heart failure. Watch this video.
Your heart is a muscle that pumps blood around your body. The term heart failure can sound frightening, but it simply means that your heart can't pump blood as well as it should. Heart failure can be caused by a number of things, most commonly a heart attack, high blood pressure, problems with heart valves, or cardiomyopathy, a disease of the heart muscle. Joe has just been diagnosed with heart failure. Because his heart can't pump blood around his body as well as it should, it's causing symptoms in different parts of his body. When blood isn't flowing properly, it can lead to a build-up of fluid or congestion, a bit like a traffic jam. This fluid sometimes builds up in Joe's lungs, leaving him breathless. Fluid can also build up elsewhere in Joe's body. He notices this as weight gain and swelling in his feet, legs, lower back and abdomen. Joe also suffers from fatigue because his heart can't deliver enough oxygen-rich blood to his muscles. With your continued support, we're funding research to one day find a cure for heart failure. Right now, Joe uses medication to manage the symptoms and help him have a good quality of life. Joe has also made some lifestyle changes to help keep his heart healthy, such as quitting smoking, cutting down on alcohol and salt, staying active and keeping a healthy weight. Joe doesn't need any further treatments at the moment, but because heart failure can get worse over time, he may need them in the future. Some people are recommended to have a pacemaker or implantable cardioverter defibrillator, ICD, to help treat their heart failure. Joe spoke to his doctor about the impact his heart failure could have on his driving, getting car and travel insurance, and his work. His doctor has also recommended a cardiac rehabilitation program to help him get back to as full a life as possible. The program has improved Joe's energy and stamina, and gave him the emotional support he needed when feeling low. This has helped Joe to continue enjoying life. For more information on living with heart failure, visit bhf.org.uk. BHF. Beat heartbreak from heart failure. Beat heartbreak forever.
So essentially, heart failure means failure of the cardiac pump, because the heart is a pump, pumps blood to the rest of the body. And the most common cause is the narrowing of the blood vessels in the heart, or your coronary arteries. Well, due to the high cholesterol and all the unhealthy lifestyle. Or it could also be caused by high blood pressure, which is not controlled, because then the heart needs to pump against a very high blood tension or high blood pressure. So the heart becomes overworked. And when it fails, it will no longer provide enough blood supply to your organs. So you have easy fatigability. The patient gets tired easily. It's called forward failure. There's also backward failure. So if the heart isn't able to pump well, some of the blood dumps back into the pulmonary system. Because the blood to the heart, to the left side of the heart, comes from the lungs, right? So if the blood stays in the lungs, it will seep out of your blood vessels and into your alveoli. So your alveoli becomes flooded with fluid, and gas exchange is impaired. So the patient has difficulty breathing. And because of the damming back of the pressure down to all your blood vessels, you'll have swelling of the legs, swelling even of the abdomen. There can be fluid in your abdomen. And that's the reason why they can't lie flat unless you're able to treat the heart failure. Forward and backward failure. And the doctors will give medications for this, but we have to correct lifestyle. Balanced diet, exercise, stress management, and avoiding smoking and alcohol. And there should be proper control of the other diseases like coronary artery disease, hypertension, and diabetes, which means normal blood sugar, normal BP, normal lipid profile. So those are the things we need to accomplish to prevent congestive heart failure. Okay, we move on to piece number 3. This is a 60-year-old female diabetic with a 1-week history of cough and yellow phlegm associated with fever in the last 3 days. When the doctor listens, there's crackles at the right base of the lung. So, what do you think is the most likely diagnosis? Is this A, pulmonary tuberculosis? Raise your hand. There's one person. Is this B, pneumonia? How many thinks this is pneumonia? A handful, or maybe around 10%. Okay. Who thinks this is COPD, or chronic obstructive pulmonary disease? Oh, one person. Thank you. Bronchial asthma. Even a few people, also a handful. The rest did not commit to any diagnosis. But to those who said pneumonia, you are correct. So what is pneumonia? Watch this video.
Pneumonia is an infection of the lungs. The infection can be from a virus, from bacteria, or from a fungus. People of any age can get pneumonia, but it's particularly serious when it's a baby or a child or someone over the age of 65. When people get pneumonia, the air sacs in their lungs can fill up with phlegm or pus. That means they're coughing up that phlegm and they can have difficulty breathing. Other signs of pneumonia include fever, fatigue, and chest pain. Doctors diagnose pneumonia in a number of ways, including blood tests and chest x-rays. Bacterial pneumonia is treated with antibiotics, and often patients stay home. Often they'll feel better in a few days or weeks, but they can feel very tired for more than a month. People with pneumonia sometimes do need to be hospitalized. Often it's because they're having such difficulty breathing that they need help, or their blood pressure, or their temperature, or their heart rate dip too low. Doctors tell people who are recovering from pneumonia not to jump back into their regular routine too quickly. If they do, then complications from pneumonia can arise, and those complications can be serious or even deadly.
To recapitulate, pneumonia is an infection that inflames the air sacs. So, wrong spelling, kung yun ang CNN ha, air sac na may sako, letter A, air sacs, the alveoli or the air sacs. So, of course, you have cough, phlegm, and fever, and chills, and abnormal breath sounds. And chest x-ray will confirm that there is haziness in the area. It's called infiltrates. And pneumonia is very serious in the extremes of age, the very young and the very old. Pneumonia and the heart. So earlier with heart failure, we were talking about how heart disease can cause pulmonary dysfunction. This time, we're talking about how lung disease can cause cardiac dysfunction. So pneumonia is an important cause of death worldwide. And up to 30% of pneumonia cases who are admitted to the hospital will develop a new or worsening heart failure, an arrhythmia or an abnormal heart rhythm, myocardial infarction or a heart attack, and even a stroke. So, pneumonia, because it impairs gas exchange, could lead to a low oxygen level. And if there's not enough oxygen to supply the heart, that's when you can have heart failure, you can have arrhythmias. You can even have a heart attack or a stroke. And also the fever, the infection, it increases your heart rate. There's a sympathetic neurologic response. Tasig ang heart rate, tasig ang contractility of the heart. And that also damages the heart. As well as, there are some bacteria which are directly toxic to the heart. So lung disease can cause cardiac dysfunction. So we treat pneumonia with a pathogen-directed treatment. So you can't treat a viral pneumonia with an antibiotic. Only a bacterial pneumonia will respond to an antibiotic. You treat a viral pneumonia with an antiviral and a fungal pneumonia with an antifungal. But there's only very few viral infections that we can have treatment for when you get a pneumonia. So that's what's difficult with viral pneumonias. Unlike bacterial, we have a broad range of antibiotics. And of course, anyone with an infection should be well hydrated, drinking a lot of fluid, given oxygen if needed. In very severe cases with respiratory failure, that's when you come to us in the hospital, and we might need to put you on a ventilator, intubate you, hook you to the ventilator to support your life while we treat your pneumonia. So how do we prevent pneumonia? This is what's more important for you. Okay? Practice good hygiene, wash hands often, because the germs will come from your hands most likely. Number 2, keep your immune system strong. Adequate sleep, you need that. Nutritious diet and exercise. Avoid crowded places. Avoid people who cough, because they are the ones who will transmit pneumonia to you. As much as possible, when your parents bring you to your pediatrician, get that flu vaccine. Do not run away from it. It will protect you from severe pneumonia. And this is one thing I'd like to tell the faculty about, Miss. I think you should make it easier for sick students to not go to school. For 2 reasons. They need the rest to get well, and they need to not infect the classmates. So please watch the next 2 videos on how you can prevent infectious disease, especially in your lungs.
We don't want to cough and sneeze directly into our hands or directly into the air. So the best way is to cough and sneeze into a tissue or onto your folded arm or elbow.
please. We don't want to see anyone covering cough or sneeze with their hands. Not anymore. It's almost criminal. Because when you put your hands in your mouth and you touch it around, touch your friend, you'll be spreading your germs. Cough and sneeze, elbows please. Okay? And when you get to the comfort room, wash your elbow, wash your hands. From here on, we hope the teachers will check that you are coughing and sneezing into your elbow. Although that's not the best step. The best step is still to have a tissue and dispose of the tissue and wash your hands. That's the best cough etiquette. Okay?
Hand washing should take you about 1 minute. Use a timer or count from 1 to 10 in each of the following steps. Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm with the back of left hand with interlaced fingers and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow-operated, use this towel to turn on the tap without touching it directly. Your hands are now clean and safe.
So who washes hands like that? Oh, congratulations. That was a minute. That was the World Health Organization. But they have many criteria. May one happy birthday song, two happy birthday songs. Nami kito ila, 1 minute. But then, sige, if you don't have time, it's 40 seconds na lang. But do it thoroughly. And I would ask Salle to provide liquid soap. And I noticed the liquid soap is kind of dilute. Nani ang hindi diluted. But I congratulate you for that bathroom na ni ang wag sila. Because at least you don't touch it when your hands are clean already. I hope na all bathrooms will be like that with concentrated liquid soap at ready. I am about to end, but I will really need you to concentrate on this emerging infection because we're all scared of it, and rightly so. Because when it enters the Philippines, we might not have enough protective equipment, enough medicines, enough hospital beds to take care of severe patients. But then you can play a huge role while we are still waiting for that first of or COVID-19 case to enter our hospitals. I would like to ask your help to teach your family, teach everyone the proper hand washing and cough etiquette. Because if you know, mo, kita kababayan na wala ka panabon, mag-ubo, so disaster na yan. Kung magsulod ng COVID-19, hindi maupuhan na yung nakagmalat na nahin, kag wala pagkapamugas. But if we take this opportunity to teach cough etiquette and hand washing, basic pa lang. Bisan kung hindi na kung sa whole country, sa aking pamilya, diri sa Salle. So, watch this video. How is COVID-19 spread? How do you protect yourself?
COVID-19 is an infectious disease caused by a new coronavirus introduced to humans for the first time. It is spread from person to person, mainly through the droplets produced when an infected person speaks, coughs, or sneezes. These droplets can land in the mouths or noses of people who are nearby. These droplets are too heavy to travel far in the air. They only travel approximately 1 meter and quickly settle on surfaces. This is the reason person-to-person spread is happening mainly between close contacts. The exact time that the virus can survive on surfaces is not yet known. So it is wise to clean surfaces regularly, particularly in the vicinity of people infected with COVID-19. Hands touch many surfaces, which can be contaminated with the virus. You should therefore avoid touching your eyes, nose or mouth, since contaminated hands can transfer the virus from the surface to yourself. When coughing or sneezing, cover your mouth and nose with the bend of your elbow or use a disposable tissue. If a tissue is used, discard it immediately into a closed bin. The most effective way to prevent the spread of the new coronavirus is to clean your hands frequently with an alcohol-based hand rub or soap and water. This will eliminate the virus if it is on your hands. Stay healthy and prevent the spread of COVID-19.
So, in summary, we have been discussing COPD, congestive heart failure, pneumonia. And for all these diseases, we know that a healthy lifestyle is what we need to prevent them. And special emphasis on your having to use cough etiquette and hand hygiene. It must be practiced by everyone in order to prevent infectious disease. So, it's not yet our habit, but we can learn to do it para maging habit na siya. I mean, ma'am, teachers teach it from prep up to grade 12 para maging habit. We have no choice. If you don't do this, may epidemic din tayo dito sa Philippines. So, cough etiquette and hand hygiene. So, thank you so much, grade 9, for your kind attention from the Philippine College of Chest Physicians to some organization. Sir A will now.
Thank you, Dr. Locson, for giving us an engaging and interesting talk. And at this juncture, our guest will entertain the questions that we have in our mind. So for those who have questions, please just go to the microphone, state your name, from what section are you, and what's your question?
Don't be shy, ah. Walang ngiti. Kita niyo. Come on, pass. Sir A is going around, though you're answering, though your scaffold. Maybe next year we'll make it mandatory for students to bring their own alcohol, their own tissue, and to not go to school when they're sick. Maybe give them an online module. Make it easy for them to make up for class when they're sick. Do not take it against them. Do not give punishment for being sick.
Good morning, Miss. I'm Alistadio from class 9A. I just want to know what's the difference between pneumonia and pneumonitis.
Okay, thank you. Pneumonia is the clinical illness. It's the symptoms, what we listen to, the physical exam. That's the disease. Pneumonitis is an inflammation. It's a non-specific inflammation, can be caused by bacteria, irritants. So when doctors talk, we talk about pneumonia rather than pneumonitis. The ones who use the word pneumonitis are the radiologists and the pathologists, the ones who deal with specimens or images. But when you talk to a clinician, the one who views the patient as a whole, so the disease, we call it pneumonia, not pneumonitis.
Is proper health, good morning, Miss. I And I'm asking that is proper health, like taking care of your health, the best way to prevent all of these viruses into entering your body?
Yes, I agree. An ounce of prevention is worth a pound of cure. So dapat prevention with public health strategies kita. We forget that we need enough sleep to boost our immune system. We forget that we need the nutritious food and all the water we need to take in every day. And also that we need to have social distance for people who cough and to avoid crowded places. So those things are very important. And of course, wala man siguro di may nag-smoke and then may ara, get rid na. Early pa lang, get rid of smoking and drinking.
Sige, thank you, Miss.
Thank you.
Morning, Miss. My name is Rachel Dan from Leipzig. What is common among these diseases we've discussed?
You're asking straight from your scaffold. Please give me that scaffold. Sir A gave me that. Hi, Jean.
Is tuberculosis considered a pulmonary or cardiovascular disease?
Tuberculosis is mainly a pulmonary disease, but I would have wanted to discuss it, but I was only given 30 minutes. But tuberculosis can be extrapulmonary. It can hit almost any organ. You can have TB meningitis, TB liver, TB of the bone, TB of the urinary system, even TB pericarditis. There is TB of the heart, the lining of the heart, but it's mainly a pulmonary disease. Hi, Vince.
I would like to ask what are the key differences between MERS, SARS, and COVID-19?
Sir, SARS video, nag-bird SARS pa. Ginawa ko, Vince, ha? They're both viruses. They're both viruses. They're both zoonotic. They came from animals and transferred to humans. They both have no cure yet, but the COVID is really threatening us. Thank you, Vince.
Good morning, Doctor.
Hi, Paul.
Since our classroom now are air-conditioned, mostly in the high school building, would it contribute more to the spread of bacteria? And as students, Miss, what can we do in order to stop this spread of bacteria in the classroom?
So, while you're worried if your classrooms are not that suitable
Yes, Miss.
for... Well, it's true we all should be inspecting our buildings to see if it's well ventilated. It's a challenge for the school to check. But the more threat would come from your classmates rather than the classroom. Those who don't cover their cough, and those who don't wash their hands.
Thank you, Doctor.
Morning, Doctor.
Hi, Andia.
It is a known fact that COVID-19 can be eliminated in warm temperatures. So is there a chance for it to stand against the country's climate?
You are asking if there's a chance that we could avoid COVID-19 because we are in a hot country? Is that the question?
Based from what I read for some.
Okay. That is not yet proven because Singapore is in the equator and yet Singapore has so many cases. So being in a hot country should not make us feel safe. We should do our hand washing and our etiquette and keep our immune system strong. Thank you.
Hi, Doc. Good morning. I read from Dr. Mike that COVID-19 could be cured by the HIV vaccine. Is it true?
If COVID-19 can be treated with an HIV
vaccine.
There's no HIV vaccine, but there is HIV treatment. And these are the drugs they are now putting on trials. Yes, you're correct. They are still in a trial stage. As well, we're using many other antivirals, not just the HIV. Thank you.
Thank you.
Last question.
One last question.
Hello, my name is John Raylera. Is it safe to use a public alcohol station? If somebody, for instance,
Okay. So he's asking if is it safe to use the free alcohol in the comfort room. Well, we can't be sure because we don't have quality control. So but if it's Salle who will provide it, I'm sure you can rely on it. Actually, I am planning to give my children liquid soap powder. Para when they can go to in bathroom. Water lang kailangan nila, they have that soap. But if you don't have, you only really need hand washing if you have soiled hands. When you're in the classroom and it's hard to go to the bathroom, you can use your alcohol gel or your alcohol and do the steps that were shown earlier. Thank you.
And now we'll just entertain our last question.
Good morning, Doc. May I ask if influenza is which is deadlier, COVID-19 or influenza?
Thank you, Min Min. I actually did that math myself. I look at the death rate of influenza and the death rate of COVID-19, and COVID-19 is 20 times more deadly than influenza. So there is really reason for doctors to be worried that you might get infected in the hospital. We really have to spread this campaign that we have to prevent COVID-19 in our country.
Thank you, classmates, and thank you, Dr. Locson, for responding to our questions. Please, let's give a round of applause to our guest. And at this juncture, may I request Ms. Christine Bacariza, Science Department Chair, and Sir Anton Oberas, Grade 9 Science Teacher, for the giving of Certificate of Appreciation.
Good morning. The Certificate of Appreciation is presented to Dr. Marie Locson as a resource speaker on the topic Common Diseases of the Respiratory and Circulatory System, given to grade 9 students at the Integrated School as part of their Scaffold 1, given this 5th day of March 2020 at the University of St. Salle Integrated School. Signed by Ms. Christine Bacariza and Ms. Melanie Reforma, the Vice Principal for Academics. Again, let's give her a round of applause, please.
Thank you, Dr. Locson, and to our teachers. This event has almost come to an end, and as we proceed, may I request everyone to please stand for the closing prayer, to be led by Sylvina Ann Caballo of Class 9A, and to be followed by the singing of our alma mater song.
Let us remember that we are in the most holy presence of God. Let us adore. Bless us, Lord, as we leave this place. May we treasure the knowledge partaken to us. May the things we learn stir our hearts. May we have the passion to put these into actions. We thank you for giving us the opportunity to speak our minds.
different occurrence of each voice that stood to be heard. Remind us always of your love as we nurture the knowledge given to us as an instrument to show kindness to others. In the strong and loving name of Jesus, Amen. Saint Baptiste de la Salle, with Jesus in our hearts.
Hail, hail, ready, sing. Hail,